Heart disease is still the #1 cause of death worldwide, and that should bother you because we live in a time with more medications, more specialists, and more advanced hospitals than ever before. So why are so many intelligent, responsible people still struggling with blocked arteries, high blood pressure, and declining circulation? Something doesn't add up. I'm Dr. Christina Serrati. I spend my time reviewing cardiovascular research, and today I want to walk you through something most people never hear. Inside a 10-minute doctor's visit, modern medicine is exceptional in emergencies. If you're having a heart attack, you absolutely want a cardiologist, a catheter lab, and the best drugs available. But long-term heart restoration? That's a different conversation. Most medical training focuses heavily on pharmaceuticals and procedures. That's not a criticism, it's simply how the system is designed. Doctors are trained to follow standard protocols, prescribe approved medications, and manage risk markers like cholesterol numbers and blood pressure readings. But here's the quiet truth. Managing numbers is not the same as restoring artery health. There's also a structural issue in healthcare that most people never think about. Natural compounds can't be patented the way synthetic drugs can. That means they don't generate the same financial incentives for large-scale promotion or aggressive education campaigns. No patent, no exclusivity, no billion-dollar marketing budgets, so even when strong research exists, it can take years, sometimes decades, before it becomes mainstream conversation. In fact, research adoption in medicine often lags by 15 to 20 years. Think about that. We upgrade our phones every 2 years. But clinical practice can take nearly 2 decades to shift. As a researcher, my responsibility is different. I review current literature as it's published. I look at studies from 2024 and 2025 today, not 15 years from now, and recently. One particular natural compound has stood out in a very serious way. It's not trendy. It's not exotic. It's not expensive. But the vascular data behind it is compelling. Before I reveal it, we need to understand something critical about how arteries actually become blocked, because most people have been taught a simplified version that isn't biologically accurate. End. Once you understand what's really happening inside your blood vessels, the solution starts to make a lot more sense in part 2. I'm going to explain why plaque is not just grease in a pipe, and why that misunderstanding has kept millions focused on the wrong strategy. Asterisk before we talk about solutions. We need to correct one very dangerous misunderstanding. Most people picture their arteries like kitchen pipes. They imagine that when they eat fat, it sticks to the inside of the artery wall, layer after layer, until the pipe gets narrower and narrower. It sounds logical, but biologically, that's not what actually happens. Your arteries are not rigid metal tubes. They are living, flexible, intelligent tissues. The inner lining of your blood vessels is made of a delicate layer of cells called the endothelium. This layer is incredibly important. It controls blood flow, inflammation, clotting, and even how your vessels expand and contract. When the endothelium is healthy, blood flows smoothly like silk. When it's damaged, everything changes. Plaque doesn't just sit on top of the artery wall like grease. It forms underneath that delicate inner lining. And it begins with one key trigger: chronic inflammation. Think of inflammation as a tiny internal fire. When you're under constant stress, consuming excess sugar, processed foods, smoking, sleeping poorly, or dealing with high blood pressure, that inner lining becomes irritated. Small, microscopic injuries appear. Your body is smart. When it senses damage, it tries to protect you. It sends cholesterol particles, immune cells, and repair materials to that injured area. The intention is protective, like forming a scab over a wound. But if the inflammation never stops, the repair process never shuts off. Over time, that protective patch grows thicker. Calcium can deposit. The artery wall becomes stiff. The opening narrows. That buildup is what we call plaque. And here's something most people don't realize. The most dangerous plaque is not always the biggest plaque. It's the soft, unstable plaque, the kind that can rupture suddenly and form a clot. That clot is what triggers many heart attacks and strokes. So now the question becomes, if plaque is forming underneath the artery lining due to inflammation and oxidative stress, would scrubbing it away even make sense? No. In fact, breaking plaque apart aggressively would be dangerous. You don't want chunks floating through your bloodstream. What you want is something far more intelligent. You want to calm the inflammation, improve endothelial function, reduce oxidative stress, support natural cellular cleanup, help vessels regain flexibility. This is not about force. It's about restoration. Your body already has built-in repair systems. One of them is called autophagy, a cellular recycling process where damaged components are broken down and reused. Another is nitric oxide production, which allows blood vessels to relax and widen naturally. When nitric oxide levels are strong, arteries expand. Blood pressure eases. Circulation improves. Oxygen delivery increases. But as we age, nitric oxide production declines. Inflammation rises. Oxidative stress increases. Arteries stiffen. So instead of thinking about unclogging like a plumber, we should be thinking about rebalancing biology. In part 3, I'm going to introduce the specific compound that research shows can support all 5 of those mechanisms: inflammation control, oxidative balance, nitric oxide support, arterial flexibility, and plaque stabilization. And no, it's not what most people expect. Asterisk, now that you understand how plaque really forms, we can finally talk about the compound that has been quietly gaining attention in cardiovascular research. It's called aged garlic extract. And before you dismiss this because it sounds too simple, stay with me. This is not raw garlic. This is not garlic powder from your spice rack. And it's definitely not the kind that leaves you with strong breath for 2 days. Aged garlic extract is produced through a controlled breath cell aging process that lasts up to 20 months. During that time, the harsh, unstable compounds in raw garlic transform into stable, bioavailable molecules that the body can absorb efficiently. One of the most important of these compounds is called N-acetylcysteine. You don't need to memorize that name, just understand this. It's a highly stable antioxidant molecule that survives digestion and enters the bloodstream intact. That's critical, because for a compound to support arterial health, it must actually reach the vascular system without being destroyed in the stomach. Now, let's talk about what the research has shown. In recent clinical trials involving individuals with known coronary plaque, researchers used advanced imaging, including CT angiography, to track changes inside the arteries over time. Participants were divided into 2 groups. One group received a placebo. The other group received aged garlic extract daily. After 1 year, the difference was measurable. The placebo group showed continued plaque progression, but the aged garlic extract group showed slowed plaque growth, and in some cases, reductions in soft plaque volume. That is important because, as we discussed earlier, soft plaque is the unstable kind associated with rupture risk. Additionally, participants taking aged garlic extract demonstrated improved endothelial function, increased nitric oxide availability, reduced oxidative stress markers, improved arterial flexibility when arteries are more elastic. Blood flows more efficiently. The heart doesn't have to work as hard. Oxygen delivery improves throughout the body. Many individuals report secondary benefits like warmer hands and feet, improved exercise tolerance, and better overall stamina, all signs of improved circulation. Now, let me be clear about something. This is not a miracle cure. This is not an overnight fix. This is targeted biological support. Aged garlic extract appears to work in 3 primary ways. First, it helps calm vascular inflammation. Second, it acts as a powerful antioxidant, reducing oxidative rusting inside arteries. Third, it supports nitric oxide production, allowing vessels to relax naturally. It doesn't blast plaque away. Instead, it stabilizes it. It reduces internal stress. It allows the body's natural repair systems to function more efficiently out of the plant-based compounds studied for heart health. Aged garlic extract is one of the most clinically researched with hundreds of peer-reviewed publications examining its cardiovascular effects. And that brings us to the practical question. If someone wanted to use this strategically, how should it actually be taken? Because quality and dosage matter more than most people realize. In Part 4, I'll walk you through exactly what to look for, how much is typically used in research, and the biggest mistake people make when buying garlic supplements. Now that you understand what aged garlic extract does, we need to talk about something extremely important. Not all garlic supplements are the same, and this is where many people waste their money. When you walk into a store or search online, you'll see dozens of bottles that simply say garlic. Most of them contain dried garlic powder. Some contain garlic oil. Others contain crushed raw garlic capsules. Those are not the same as aged garlic extract. The research we discussed specifically uses garlic that has been aged for up to 20 months under controlled conditions. That aging process transforms unstable sulfur compounds into stable, water-soluble antioxidants, especially acetylcysteine. If the bottle does not clearly state aged garlic extract, it is not the same product used in cardiovascular studies. This is critical. Now let's talk about dosage. In the majority of clinical trials examining plaque progression and vascular function, participants were given approximately 1,200 mg per day of aged garlic extract. But here's another common mistake. It's taking it all at once. The body absorbs nutrients more efficiently when divided. Most protocols split the dosage into 600 milligrams in the morning with food, 600 milligrams in the evening with food, taking it with meals. Improves absorption and reduces the chance of mild stomach discomfort. And yes, the aged version is typically odorless. That's one of the advantages of the aging process. You get the vascular support without the strong smell associated with raw garlic. Now, let's talk about expectations. This is not like taking a pain reliever and feeling something in 30 minutes. Arterial changes happen gradually in most studies. Measurable improvements appear around the 3-month mark, with stronger data at 6 months and 12 months. Why? Because you are influencing biology at the cellular level. You're reducing oxidative stress. You're calming inflammation. You're improving nitric oxide signaling. You're supporting endothelial repair. That takes consistency. Think of it this way. If your arteries didn't become inflamed in 30 days, they won't rebalance in 30 days either. This is about daily reinforcement. Many people begin noticing subtle circulation improvements within a few months. Things like less coldness in hands and feet, improved walking endurance, slightly better blood pressure readings, feeling less heavy during activity. These are indirect signals that vascular flexibility is improving. Now, before anyone runs to order a bottle, we need to have an honest conversation about safety, because responsible heart support always includes medical awareness. In Part 5, I'm going to address the biggest fear people have about plaque reduction, who should not take aged garlic extract without supervision, and how to use it safely if you're already on heart medication. Asterisk whenever we talk about improving artery health naturally. One fear immediately comes up: what if it breaks plaque loose? I hear this concern constantly. People imagine a chunk of buildup suddenly snapping off and traveling through the bloodstream like debris in a pipe. Let me reassure you clearly and scientifically. That is not how aged garlic extract works. It does not act like a chemical drain cleaner. It does not dissolve plaque into floating fragments. It does not chip away at blockages. Remember what we discussed earlier? Plaque forms beneath the artery lining due to chronic inflammation and oxidative stress. The dangerous plaque is the soft, unstable kind that can rupture under pressure. What research suggests is that aged garlic extract helps stabilize plaque. That means it supports structural integrity. It reduces inflammatory signaling inside the vessel wall. It improves endothelial function. Over time, this environment makes plaque less likely to rupture, not more likely. Think of it like reinforcing a weak section of a wall rather than knocking it down now. Let's talk about blood thinning. Aged garlic extract has mild antiplatelet effects. That means it can slightly reduce the tendency of blood to clot aggressively. In healthy individuals, this is often beneficial for circulation. But this becomes important if you are already taking prescription blood thinners like warfarin, apixaban, clopidogrel, daily high-dose aspirin, certain heart rhythm medications, pre-surgery, or dental procedures. You are in any of those categories. You must speak with your physician before adding it. This is not optional. Natural does not mean risk-free. It means biologically active. If you have a surgery scheduled, even minor dental work, most practitioners recommend discontinuing aged garlic extract about 7 days prior, simply to ensure normal clotting response. That's standard precaution. Now, let me say something equally important. This is not a replacement for emergency cardiac care. It is not a substitute for prescribed medication without medical supervision. And it is not meant to override your cardiologist's plan. It is a supportive strategy, a tool, an addition when appropriate. Responsible cardiovascular support always includes regular monitoring blood work when necessary, blood pressure, tracking communication with your provider. You deserve comprehensive care, not extremes. And that brings us to the final piece. Because even though aged garlic extract is powerful, it does not work in isolation. In Part 6, I'm going to walk you through the 3-step heart restoration framework. I personally recommend when reviewing cardiovascular prevention strategies and how this compound fits into the bigger picture. Asterisk. Now that we've covered the science, the mechanism, and the safety, I want to zoom out because no single supplement works in isolation. If you truly want to support minutza al-seer, if you truly want to support your arteries in a meaningful way, you need a simple framework. This is the structure I personally use when evaluating cardiovascular research. Step 1. Lower the internal fire. We cannot talk about plaque without talking about inflammation. Remember, plaque begins as a response to vascular irritation. So the first step is always reducing the triggers. Excess sugar, highly processed foods, chronic stress, poor sleep, smoking, sedentary lifestyle. You don't need perfection, but you do need consistency. Even small changes like a daily 20-minute walk, increasing leafy greens, improving sleep quality can significantly reduce inflammatory burden over time. Aged garlic extract works best in a body that is not constantly fueling the fire. Think of it as reinforcing progress, not fighting chaos. Step 2. Daily vascular support. This is where aged garlic extract fits in. Used consistently at research dosages around 1,200 milligrams daily. Divided, it supports endothelial function, nitric oxide production, oxidative balance, plaque stabilization, arterial flexibility. It works quietly in the background. No dramatic sensations, no stimulant effect, just steady biological reinforcement, and consistency is everything. Most meaningful vascular improvements in studies show up between 3 to 12 months. This is long-term support, not quick relief. Step 3. Patience and 1. AGH Art Health is not about fear, it's about data. If you're concerned about your arteries, speak with your provider about appropriate testing. That might include lipid panels, inflammatory markers, blood pressure monitoring, or imaging when medically indicated. Track progress. Make informed adjustments. Stay engaged in your own care because here's what I want you to understand most. Your arteries are not fragile glass tubes waiting to shatter. They are living tissue capable of adaptation, capable of repair, capable of improvement when given the right environment. Modern medicine saves lives every day, and we are fortunate for that. But restoration requires participation. It requires daily input, intentional choices. Strategic Support. Aged garlic extract is not magic, but it is one of the most researched plant-based compounds for vascular health. And when used responsibly, it can be a powerful ally. You don't have to live in constant fear of plaque. You don't have to assume decline is inevitable. Science continues to evolve. And so can you. I'm Dr. Christina Serrati. If this helped clarify things for you, consider sharing it with someone who needs balanced, research-driven information about heart health. And I'll see you in the next discussion.